Broadcasting live and in high definition for all North Texas. Fox 4 News starts now.
Dallas Ebola patient Thomas Duncan has been downgraded to critical condition almost a week after he was rushed to the hospital. Good evening, I'm Brandon Todd. Duncan was staying in a northeast Dallas apartment with his girlfriend, Louise Tro, her son, and two nephews. The family was legally ordered to stay in that apartment, but Fox 4 was there when County Judge Jenkins walked them out to take them to a private home, while cleaning crews were still on scene in protective gear, clearing items out of the apartment. First on Fox 4, James Rose is at Texas Health Presbyterian, where Duncan is tonight. Talked to Jenkins today about his decision to enter that contaminated home without protective gear himself. James.
Well, Brandon, Judge Jenkins and I had a very candid conversation this afternoon. After all, he is the man in the middle of this medical crisis. He says, on the one hand, he's trying to balance compassion for those isolated. On the other hand, he's trying to reassure the public at large. And while all that's going on, Thomas Duncan is here fighting for his life.
When you get downgraded from serious to critical, that's not good. I mean, it means that his body is not fighting the virus adequately, and they've had to elevate him to a higher level of care.
Dallas Family Medicine Dr. James Pinkney says Ebola patient Thomas Duncan is receiving the best possible health care in the country at Texas Health Presbyterian Hospital. But the virus affects everyone differently.
Our hearts and prayers go out to him and to his family as he battles for his life. It doesn't change anything as far as the work our disease detectives and our other people are doing today.
Dallas County Judge Jenkins is overseeing the bigger picture of stopping the spread of the deadly virus and calming the fears of residents. Friday, Jenkins entered the contaminated apartment where Duncan fell ill without protective gear.
They need to see a person that saw them as people, not a spaceman in a hazmat suit.
He escorted Duncan's girlfriend, Louise Tro, her son, and two nephews out of the apartment to a safe, undisclosed location.
I told them I thought that they were a brave family, and I was proud of the way they were handling things, and talked to one young man about his school, and we just had a conversation like people would have, along the roads. It was a fairly normal ride, except for the fact that they're being monitored for a serious illness, and we're being surrounded by squad cars.
And some people would say you're either really brave or plumb crazy to go in there and then ride with them. What do you say to them?
There is zero chance of me contracting the Ebola virus from asymptomatic people, even if they have the virus. And I needed the public to know, when I'm telling you it's safe, if your child has gone to school with a child who's been exposed but is asymptomatic, I think a picture's worth 1,000 words to both Louise and her family and to you.
What did your wife say?
My wife was probably a lot like a lot of people, very, concerned, very worried about it. I explained the science to her. Of course, she reminded me, as wives will do, that I'm not a scientist. I told her I'd be happy to have a CDC call for her and the family. She decided that would not be necessary, and she's letting me sleep in the house.
You are not contagious until you start developing symptoms. So there's no risk of transmission if you come in contact with someone who has been infected but doesn't show signs yet.
Would you have done what he did?
Probably not.
And there's probably not a lot of people that would have done that, but I can tell you that Judge Jenkins did have not only the permission of the CDC, he says the CDC and other health organizations actually praised him for doing that, bringing it out and letting people know that it is not contagious if you don't have any of the symptoms. And besides, he said the bottom line is he would never ask someone, especially like a first responder, to do something he's not willing to do himself. Brandon?
Yeah, James, now this isn't the first time that Jenkins has had the eyes of the nation on him. Everybody kind of remembers the deaths associated with the West Nile virus. Did he offer any comparison to that?
We did, actually. We talked about that in 2012, the West Nile virus, as you recall. Dallas was ground zero for that. In fact, the latest numbers, 20 fatalities related to West Nile virus in Dallas County alone. And so, he said he was comforted by a lot of things. Many of the same team members that are with him working on this Ebola virus case were there with him for West Nile. And we're talking about the same guy from the CDC, the same guy from the Texas Health Department, as well as Zach Thompson with the Dallas County Health and Human Services. So he's got quite a team assembled, already in place, and he told me that the CDC is kind of looking over their shoulder. This is kind of a roadmap, since this Ebola virus diagnosis in Dallas is the first ever in America. You know, they're learning a lot of things, documenting a lot of things as best practices, what works, what doesn't. So, you know, there is absolutely a lot going on here behind the scenes. There's an emergency operations center going, and, you know, one thing that he did say is that, you know, they had 20 deaths in West Nile virus, and so far this year, we have not had any deaths, even with this Ebola virus. Brandon?
All right, James Rose, good information there. Thank you.